And I think this event really builds on that conversation in June. And importantly, it involves many more people, all of you who can make a difference. So we're here to share what we know and learn today what we can. So I hope you're going to take away some new connections, some new knowledge, and some new inspiration from the meeting and from all the discussions that we'll have. So just to move on to talk about some of the evidence behind whole family support. So in Scotland, we have a national outcome to ensure that every child grows up loved, safe, and respected to realise their full potential. And in support of this, we have 3 interconnected and ambitious goals by 2030 that you can see on the slide: to reduce child poverty, keep the promise, and reduce early development concerns, all improving the well-being of our families. And these goals are fundamental to getting it right for every child. And getting it right for every child, I know, has got a lot of intention internationally. Colleagues tell me that when I go and visit other countries. And it's guided our hand for almost 20 years, a very important framework, and we build on that in our services. And the connections between these goals are really strong. We know that the stresses that are caused by poverty make it harder for families to nurture their babies and children. And we know that this increases the risk of child development concerns or even the risk of care. So the impact of not getting it right in those early years is profound. And if we don't do that, we're often looking at those interconnections across generations that make it really challenging in our communities and for our public services. So I know all of you are here today because we know it's crucial that we join up across our services, and whole family support is a key driver, and I'm going to talk in a minute just about what that means in practice. So let me share with you some of the data, and this is important. So how are we doing in these 3 interconnected goals? Now, child poverty is a huge international challenge and a challenge here in Scotland, and we know that we've had a cost of living crisis, a pandemic, and other factors that have really affected families across the country. But we are making progress. Now, relative poverty, and that's if household incomes are significantly lower than the median income of the population, that's what's shown on this slide, is one of several targets that we're looking at in relation to child poverty. Compared to the UK as a whole, child poverty rates on relative poverty have been 9 percentage points below the average. So we are making huge progress relative to other parts of the UK, and that is something to celebrate. But to meet the target, the ambitious target that we have, to have fewer than 10% of children in poverty by 2030, we need to lift an additional 100,000 children out of poverty. And that's going to require a substantial change and further action that all of you have a role to play in achieving. So we need to focus on income and costs, but we also need to focus on prevention and early intervention, supporting improvements and wider outcomes for family, and mitigating the impact of poverty so that all of our children can thrive. So just a couple of other points. We also need to reduce the need for care. Now, I've been asked to chair a new group looking at data and evidence on the promise, and this is we're laser focused on making sure we can evidence the progress that is made. The latest social work statistics show that the number of children and young people in care is reducing. It's down by just over 18% since the promise was made in 2020, and the lowest rate since 2005. But that still means that we have around 11,800 children and young people, more than 1.2 in every 100 children are in care in Scotland. Of these, 20% are looked after at home, with about a third each in foster care and kinship care, and 11% in residential accommodation. Now, it's very difficult to compare between the different countries, the different nations of the UK, because the thresholds are different. However, you can see by looking at this slide that Scotland is bucking the trend compared to the rest of the UK, and the rate of looked after children is falling, and we need to continue that progress. And you're going to hear more about that in some of the workshops. But the promise tells us that the outcomes for our care experienced population are lower. Just over half, 54%, of looked after children have a home address prior to entering care in one of the 20% most deprived areas in Scotland, and that compares to 3% who from one of the 20% least deprived areas of Scotland. So that link between poverty, care, and poor outcomes is real and has been persistent. So adopting whole family support is key. That's going to be a mechanism for us supporting and avoiding that experience of care. And it's particularly important, and I'm going to move on to this in the next slide, that we think about the early years. So the factors that lead to care often happen very early in life, and early child development is one indicator of these. With 40% of children who were recorded as looked after at their 27 to 30-month review having a developmental concern compared with 17% of other children. So prevention from the earliest stages of life is critical. And you can see from this chart that there are clear inequalities in that gradient. Children in the most 20% deprived areas in Scotland are 2.5 times more likely to have one or more concerns about their development identified by their health visitor than those in the least deprived areas. And why is it important? Why is that important? We know that the evidence tells us that the environment and the experiences in those early years of life shape our brains and our bodies, creating the building blocks for our physical, emotional, and cognitive skills and our long-term health and well-being. And when a baby's development falls behind in those early years of life, without additional support, it's likely that they will fall even further behind in subsequent years. And we've got a lot of evidence internationally and from Scotland that supports that. So unless we can address those early years and really break down the barriers that prevent us from reducing those inequalities and outcomes, they will perpetuate. So if we can support our children in the first years of life, then we're really setting them up for more success in the future. So the wraparound support that we want to achieve in the early years, I suppose, is a golden moment where families can be more receptive to advice and support, and this can have the greatest impact on future outcomes. So let's move on now to what is whole family support. And this is a very important part of just these opening remarks, because I want to make sure that we're all on the same page about the key elements and also the key principles behind this approach. And I know all of you are doing this locally, but if we're all united in it, then we can talk about the different components and how we evidence the outcomes. So we have a complex system, but there are three elements. The first is practical support in terms of parenting or housing, physical health and disability, or help to find training and jobs. The second component is financial support that reduces the levels of poverty and its related stresses, and the emotional support, the third component, to help with relationships, coping, and improve mental health. So everyone here is playing a part in these different components, but I guess the question I would ask you, a challenge from me, is are we integrating them sufficiently across the country? And are we learning and not recreating, not reinventing the wheel from areas that we know are doing it well? So that's a key point for discussion today. And just finally on the principles, and you've got them on the materials that are shared for this meeting, the principles of holistic family support are really key as well. So those services that are centered not around the service, but around the whole person and the whole family and all its shapes and forms. They're co-designed with the community so that services reflect what local people actually need. And each family's circumstances are unique, and the support should be too. So whole family support gives frontline staff the ability to make that tailored support happen. It puts their strengths, needs, their likes and dislikes at the center of support and involves them in decision-making. And for frontline staff, it empowers them to respond flexibly, and I know this is not always easy, to people's needs, no matter what those needs might be, whether they're practical or emotional. So that means that people can get support in the right place, they're not giving the same information multiple times at the right time, the first port of call, it's seamless, it's tailored, and it's integrated. And that means that we can respond to people's needs more quickly, more effectively, minimizing risks, and importantly, preventing things from getting worse. So it's that early intervention, that prevention focus. So the challenge today, as I mentioned, is to think about how we can get these things to happen in practice. Whether you're a politician, you're a system leader, or you're supporting families yourself day to day, everybody has a contribution to make. So the last thing I just want to emphasize, and I think this is about today as well, is, people often ask me how I'm finding my time in government and, how does it compare to research or, as I've done before, working in the charity sector or internationally. And I always say, the same thing applies. It's about relationships. It's about building relationships, understanding your colleagues, the contribution that everybody has to make. And in this meeting today, it's about relationships with the people that we serve across Scotland. So that's between parents and children, relationships with families, supporting communities to be more connected, relationships between services, between professionals in those services, and services working together to provide that joined-up support. So that's why it's fantastic that you're all here today, and I hope you'll take the opportunity to connect with conversations and with your colleagues from across the country and reflect on how your relationships can provide more holistic support to the people who need it most. So as I say, I'm going to introduce the First Minister now. If you've got questions for him, please pop them in the app. But before I do that, just one brief anecdote is that I was really delighted a few weeks ago to have an invitation to spend some time with the First Minister, have a meeting with him in Bute House. I was getting all my material prepared, all the data and evidence that we're working on across government to give him an update. And then just a couple of days before the meeting, it was cancelled. I thought, you know, it's really actually a very busy job the First Minister has. But then I discovered actually the reason the First Minister couldn't meet with me is because he'd been invited to the White House and into the Oval Office to meet President Trump. And, you know, I thought, Linda, on this one occasion, I'm not going to take it personally. So we have a chance to hear from him now. I'm really delighted to introduce John Swinney, MSP, the First Minister for Scotland. Thank you.
Thank you very much, Linda, and I'm so sorry about the cancellation of the meeting. I'll leave it to you all to decide what was the easier gig. Talking to Professor Linda Bald and the challenge that would come from her, or talking to the President of the United States and the challenge that would come from him as well. And you can perhaps talk about that in the discussion groups in the course of today. I'm really grateful to you all for coming today to what I consider to be an absolutely pivotal conversation in our journey to make sure that we deliver effective whole family support. As we say in the conference material today, whole family support, getting it right for everyone. Because this moment for me is central, absolutely central to my government's agenda. When I became First Minister about 16 months ago, a journalist asked me on the day I became First Minister, what will be your biggest priority as First Minister? And I said my biggest priority would be eradicating child poverty. And that reflects essentially the importance that I attach to what we're talking about today, what we talked about in the session where I brought leadership figures together earlier on the summer in June, and what's underpinned a whole series of actions that the government has taken to increase the priority around the challenge of eradicating child poverty. And so I want to map that out to you at the very outset to reflect the significance I attach to the conversations that we're having here today. Because as Linda set out in the presentation, there's a whole amount of information that demonstrates quite clearly that we are making progress in the journey to eradicate child poverty. We are seeing child poverty levels in Scotland today that are lower than they were 30 years ago. We are seeing child poverty levels falling in Scotland when they're rising in the rest of the United Kingdom. But they are not falling enough. There is more that we have to do to advance that agenda. And I want to take a moment to explain why the eradication of child poverty is so central to my agenda and so central, in my view, to the future of our country. The government has 4 policy priorities: the eradication of child poverty, boosting economic growth in Scotland, making the transition to net zero, and improving our public services, particularly the National Health Service. And the danger of having 4 priorities and me articulating them like that is that there is a sense that those represent 4 individual discrete compartments, that there is not a connection between them. But I want to be absolutely crystal clear at the outset that I view there being a very direct relationship and connection between these 4 particular themes. If we don't successfully address the challenges of climate change, we will be wrestling with enormous difficulties in the years to come within our society. Indeed, a number of public authorities are already wrestling with those challenges today. So they affect the future of our society if we don't address the implications of climate change. If we don't stimulate our economy to the extent that we need to generate the wealth in our society, we will not have the ability to invest as I would want to see us invest in our public services, and particularly to enhance the health and social care services that are so important and so many of our population depend on, and particularly will depend on in the years to come as the population is made up of a larger proportion of older people than even today. And we won't be able to realise the full potential of our country in generating that wealth if we don't have people who are participating in our economy fully and effectively to make their contribution to the generation of wealth in our society, which is why we need to make sure that children that are born into our society are able to grow up to live fulfilled lives that can contribute to our society in all of its respects, but particularly to make that economic contribution to our society. So when you hear me talking about the centrality of the eradication of child poverty, believe me, it's right at the heart of the government's programme, because the government's programme, in all of its respects, whether it's about growing the economy or making the transition to net zero or improving our public services, is all underpinned by whether we have an active and engaged and participative population that is able to make that contribution. And as you will all know, because of the work that you do, there are too many people in our society today who have been damaged by the experiences that they have had in their earlier years. And the focus that Linda demonstrated in that presentation is an absolutely relentless focus within government around the agendas, which are all interlinked, of getting it right for every child, a 20-year agenda that has helped us to improve the delivery of children's services in Scotland over that period. The work that we're committed to at this midpoint in the promise, 5 years in, 5 years to go in the promise, to significantly transform the experience of children who may be exposed to care, and fundamentally the agenda of eradicating child poverty. So all of those agendas come together in a way that needs us to act together and decisively to support families that face difficulties, and crucially to support families who face difficulty at the earliest possible opportunity that becomes visible or apparent. And just in the conversations that I've had today in the coffee room, I've been able to speak to a whole range of different practitioners who are here today, who are actively involved in that early intervention activity to ensure that we are moving as quickly as we can to support those who may well be in need and who may need our support. Because that whole approach, the development of effective whole family support, is critical to how we succeed in our journey of eradicating child poverty and ensuring that children in our society have the best opportunities and the best prospects they possibly can have. And that essentially brings me to characterise this agenda in the way that I think of it, and that I want you to think about this. This is essentially a national mission for Scotland. This is our central mission as a country to ensure that together we are able to succeed in this journey of eradicating child poverty. Now, I think there's a huge amount of tremendously good work that's going on in Scotland today. I'll give you a couple of examples of things I've seen very recently, which passed the test for me of whole family support. I was out in Greater Easterhouse a few weeks ago, visiting a medical practice, Oakwood Medical Practice, where as a consequence of some pilot funding, I know it's pilot funding, I'll come on to talk about these things in a moment, pilot funding for family link workers who are working with the GP practice in supporting families. And what I found out in those discussions and looking at that project is the family link workers are out there working with families who are essentially quite regular attenders at GP practices. But because the family link workers are working so closely, so intently with families, tackling issues such as housing or childcare or language barriers or financial issues or access to transport services, because they're doing all of that, they are supporting families to build resilience and build capacity, and as a consequence, the GPs were telling me that those families were making fewer and fewer calls on the time of GPs because they had support to get on with the issues that were causing them difficulty. So there's just one very simple example of how whole family support, of assisting families to overcome their difficulties, can then have a beneficial effect in other public services, freeing up those GPs to concentrate on deploying their skills where they are required in their busy lives. Another example was in Maryhill, where I went to visit a project taken forward by the wonderful charity Homestart. And Homestart essentially was what I would describe as the friendly anchor point. They were there as an accessible service within the Maryhill community. They were there to gather together families who were in need. And public sector agencies, Greater Glasgow and Clyde Health Board, City of Glasgow Council, had located some of their teams in and around about this centre to help to provide services in a coordinated and cohesive way around families. So families were not having to go here, there and everywhere to access support. They went to a friendly, safe and supported place hosted by Homestart, and they found access to the professional assistance of some of our great professionals in the health service and in local authority activity. And it illustrated to me, I suppose, the design of whole family support that is so crucial in bringing services to people rather than requiring people to go to the services around our community. Now, those are two really good examples, and there will be countless other examples that you will have created and innovated and designed in your parts of the country. But I think we all have to honestly accept that two things. Firstly, that there's not enough of that, and secondly, that it's not nearly systemic enough around our country. So there'll be great examples, as I've just given you those two examples, and I could have taken other. I happen to be in Glasgow today, so those examples are fresh in my mind. I could have talked about other examples that I've seen in other parts of the country. But my appeal today is for us to all consider ourselves, those we rub shoulders with in our teams around the country, those that we work with in our communities, to sign up to a national mission to eradicate child poverty, working on that basis. And what does that involve? Well, it involves us breaking down some of the barriers that exist between public services and making sure that services are aligned and cohesive around individuals in the way that I cited in those examples. It involves us not viewing governance or who holds a budget as an obstacle or a barrier to enabling that type of collaboration to take place. It involves us looking for ways in which we can perhaps do things differently to how we have previously done things, but crucially driven by how do we assemble services around families. Because all of the evidence and research and data that I look at convinces me that an essential element of how we progress on this journey must be by the delivery of whole family support, because that is our pathway to eradicate child poverty. Now, the government can do certain things. It can take significant strategic decisions, such as introducing the Scottish Child Payment, which is providing real and tangible support to families in financial difficulty around the country. So, to the triumvirate of interventions that Linda talked about earlier on, the Scottish Child Payment contributes significantly. In March of next year, the Scottish Government will lift the two-child limit, which will enable more families to be supported as a consequence of our intervention. The Government can also fund some of the innovative work that's been taken forward in the Fairer Future partnerships, which today we are extending to a wider range of communities. These partnerships have done outstanding work. They are tremendously refreshing approaches, and today we'll be expanding those partnerships to a range of different areas in the country to ensure that more parts of the country are able to benefit from that type of intervention. So the government can do all of these proactive things. The government's also got to be flexible and responsive in some of the governance that we put out as a consequence of our interventions. You know, having to supply a report to the government, having to account for particular ways in which programmes are taken forward can be cumbersome and obstructive. And I'm committing the government to look as flexibly as we can with public authorities and our agency partners to try to avoid that unnecessary bureaucracy. And of course, the government has got to listen to all of our partners around the country who might say to us, well, look, if the government was able to act differently in this respect, we could make more of an impact as a consequence. And I'm very open, my ministers are very open for that conversation to take place. But fundamentally, what we depend upon is the extent to which all of those involved in this area of policy around the country, in our public authorities, in our third sector organisations, in the private sector, in our communities, in the charitable sector in Scotland, we've got to operate in a fashion that all of us are together working on a national mission to eradicate child poverty by boosting whole family support to families who are in need and getting that support to them as early as possible. So I suppose my invitation to you today is to participate in that endeavour, to participate even more in that endeavour, because I recognise that many of you are already participating in this work. But it's also to do something which I suppose, in some respects, well, I'm going to do it, whether I'm entitled to do it or not, I'm going to do it anyway, is to give you permission to think out with the current arrangements in which we are operating, to essentially enable you to think differently and to operate differently from how you've operated before, and to encourage that culture to develop within Scotland, whereby we find the innovative ways of delivering whole family support. So my purpose today is to give you permission to do that, to encourage you to do that, and to enable you to do that. And the Scottish Government will be full partners in all of that endeavour. But we can only succeed in this journey if we align all of our activity behind the agenda of eradicating child poverty, of getting it right for every child, of succeeding in our journey in the promise, and in making sure that the early years of children's lives are the best they possibly can be as a consequence of our intervention. If we do that, then those charts that Linda talked about earlier on will continue to move in the right direction. And what we will be doing as a consequence is something which is so crucial for the future of our country, and that will be about improving the life chances of children in Scotland today. So quite literally, the conversations we have today are about the future of Scotland and our ability to shape it. And I invite you to be part of that journey with me. Thank you very much.
Thank you, First Minister. So it's great to have an opportunity now to ask a few questions and hear your views, and we've got a fantastic list of questions that colleagues have put in. So I talked about, and you also talked about, the importance of the early years, and a lot of whole family support, of course, is focused on parents and children, young children. But very importantly, you and I know that supporting young people as part of whole family support is essential as well. And that can be a time in life when things actually are even more difficult for many families. So what are your thoughts on how we make sure that we're not neglecting our teenagers and our young adults?
I think this is an important question, and it's vital that we use every opportunity to mobilise support and intervention to assist young people at every stage in their journey. So when I look at the the work that goes on in schools nowadays. Schools are performing a much broader role in our society today, whereby they are having to recognise some of the challenges that young people are facing in their lives and putting in place the resources and the arrangements to support young people in that respect. But we've also got to recognise the importance of some of the support services that come through youth work, and local authorities are commissioning lots of such interventions in different parts of Scotland to make sure that young people's needs are met. But fundamentally, the message of my contribution today is relevant to children of any age. It's about assembling around the individual the support they require to have to help them to overcome their difficulties so they can be a full and active participant in our society. And those approaches are the ones that we need to develop as a consequence of our conversations here and in other places to ensure that the needs of every young person are met as a consequence.
Thank you for that. So the second question is an issue that's quite close to my heart and I know is a challenge. So how can we challenge, this colleague said, the risk-averse nature of local authorities or the public sector, particularly around the use of data and connecting data as a tool to address poverty?
I understand the anxiety around this question, but it is absolutely fundamental because our careful use of data to try to identify situations where our support can best be targeted is fundamental to this approach. So implicit in what I'm saying is that there has to be very targeted support in Scotland to meet the needs of those who face greatest challenge. And you can only do that through, well, you can do it through, I suppose you can do it through community connection and through dialogue and engagement, but data is going to help significantly to do that. And I think the crucial point here is about responsible and careful data handling. And public authorities have got statutory duties in this respect, but those statutory duties should never be viewed as barriers and obstacles. They should be requirements that have to be put in place in a system that will actually enable us to identify those who need support. And in a couple of conversations that I had before I came in today, I was hearing, I suppose the common theme coming through a number of those conversations was about the success of early intervention. So all of what I was hearing about, and I hear this all the time when I'm out and about, is I'm hearing from people who see the benefits and the value of early intervention and see the outcomes as a consequence of being able to support children and families at the earliest possible opportunity. And data is going to be a crucial factor in enabling that to be the case. But I think I can't take away the anxiety about data management, but I can encourage a focus on its careful management and handling so that we get the benefit, that we get the greatest benefits of the use of data.
And also, I suppose, the point I made earlier about for our families and communities when they're giving their information, that they don't have to give it multiple times, so that we're connecting up that sharing between organisations.
But I think that gets to the sort of what I would call the pillar to post territory, where families, like we all know what it looks like. I've been a member of Parliament for 28 years. I've sat with constituents in village and town halls around Perthshire all those years, listening to examples when families have gone from pillar to post, and when they come to me, they're generally at the end of their tenure. And we all know what that looks like. We know how stressful that is. We know how much damage comes from that. And actually, so many of these different elements could be resolved by more effective use of and handling of data to identify where resources might well be best targeted to have the best effect.
Great, and I know we're going to have workshops on many of these themes. I'm going to roll two questions into one that colleagues have asked. And now this is a cross-sector, cross-society endeavour, as we've discussed. So I wanted to ask you about the importance of what do you see the role of the third sector in this, and maybe some examples that you have. And then also the second part of that is community planning partnerships, which I know have different approaches across different parts of the country and are more or less engaged.
On the third sector, I view the third sector as being absolutely pivotal in this journey. So let's go back to my example about Home Start and Maryhill. Home Start is a great organisation. I've seen them at work in my own community in the city of Perth, providing, through essentially the mobilisation of volunteer capacity within the community, good support to families. So Home Start will have, as an example, various other organisations will have similar credentials. I've seen tremendous projects taken forward also by Children First or Aberlour, where the model, I think, is there for us all to see, where a third sector organisation essentially builds that relationship that you talked about earlier on, Linda, where the relationship is built with a family and then various other supports from public authorities are wrapped around about that support. So I see the third sector as pivotal in all of that activity to ensure that there is the ability to draw together in a trusted, safe environment all of those different interventions from different public authorities. So I think the third sector's got a huge role to play in all of that.
And on to community planning partnerships, just about how we can improve them. Yeah.
I think this is, when I first went into government, I put a lot of time and energy into driving a much greater role for community planning partnerships in the delivery of public services and in improving outcomes in localities. And why did I do that? Well, I did that because in that context, community planning partnerships can be very effective at breaking down barriers, making sure that we don't all operate in compartments. And I think, and that's a very real danger here, that public services operate in a very compartmentalised fashion. My appeal today is basically to overcome all of that. To get, we can't have good outcomes being delivered if public services are not aligned to a common purpose. And at local level, community planning partnerships will enable a lot of that to happen. And they are forums in which tangible benefits for people will come by changing the operating model at local level. Now, if there's barriers in the way of that, let's, for argument's sake, let's speculate wildly that maybe accountability to government is a barrier to all of that. Then I'm willing to have the conversation about how do we tackle that? Because without moving out of those compartments, we will not get the full value and benefit of the working together between different public sector organisations.
Thank you for that. Really, really helpful. And again, many colleagues here who are involved in CPPs and working in voluntary organisations as well. Next question I want to ask you, we're just in the process of completing a report, First Minister, on the changes in rural poverty in Scotland in recent decades, which are quite striking between remote and rural, different communities. So we've been talking, the examples you and I perhaps have given have been from urban areas. So what are the particular challenges around whole family support delivery in rural areas? And I know we've got colleagues here from Shetland, Orkney and elsewhere. What should we be thinking about there in this model?
There's a few really relevant points here. The first is that, and the government is doing this, we just had discussions at Cabinet yesterday about this particular point, about the use of data to better enable targeted support to families, which comes beneath some of the traditional data sets that we use, such as the Scottish Index of Multiple Deprivation. That will, SIMD classification is not going to give us as fine-grained a view of the existence of poverty in rural and remote areas as we would like. So we were discussing yesterday how we can different steps that we can take to establish a much more targeted approach in that respect. So there are data handling issues that we can confront to do that. Second area is that actually, when I spend a lot of time in our island communities. They are very close to my heart, and in our remote and rural communities. And ironically, they are probably best placed to break down some of the barriers. If you take a community such as the Western Isles, a population of about 25,000, those public authorities, if they come together working with the third sector, there are many fewer cases and families to be supported, and therefore the support can be as focused as it possibly could be. So we're having various discussions with Western Isles Council, Colony and Share, Orkney Islands Council and Shetland Islands Council on how we can give them ever more flexibility to work with public sector partners to essentially make that support ever more seamless in remote areas. And that's a conversation that I'm very keen to foster with different remote and rural communities, because I think some of the effectiveness of our work in eradicating child poverty or in delivering whole family support is complementary to delivering sustainable public services in areas where it will be a challenge to do so because of the sparseness of the population. So I think there's a number of different points that come together that give us a good opportunity to make that difference.
Great, and we'll hear some fantastic examples from across the country later. So I'm just going to ask you a couple more questions. Won't be able to cover them all. So just this week, First Minister, I'm going to ask you about alcohol and drugs within whole family support. We've seen the statistics on alcohol mortality, slight reduction that came out yesterday, and we still have huge challenges around drugs in Scotland. So a number of the families that colleagues will be working with across the country have had experience of alcohol and drug misuse. So how does that fit in whole family support, and why is that such an important component? Thanks.
I think what strikes me about the necessity of the whole family support approach is that it recognises where people are, not where we would like them to be, where they are. And that's a crucial starting point. So I saw this wonderful short play. It's just a scene, really, at a school when I was education secretary. And forgive me, Linda, I'm now going to tell a long story in answering your question. But
we've got time.
Indulge me for a moment. And this play was performed by the pupils, and it basically started with a pupil coming into a classroom having not completed their homework, and a shouting match emerging between a teacher and a pupil about not completing the homework. And the scene of the classroom conflict then moves to two separate scenes, which is home for the child and home for the teacher. So, home for the child is a scene of chaos. This child who hadn't done the homework was looking after another child, and the parent was drunk, and it was a total shambles. The other end of the stage, teacher goes back to their home and their partner and says, "Oh, John Swinney never handed his homework in again." And partner says, and went on about, it's an hour time, and the partner said, "Did you ask why not?" And the teacher said, "Well, no, I didn't." So scene 2 is back in the classroom. "I've not done my homework." And teacher said, "Is everything okay?" And there then turns out a completely different conversation. Now, I use that as a bit of an illustration that the potential of a child to be fulfilled will be inhibited. Well, it's likely to be inhibited. It won't always be, but it's likely to be inhibited if there is a drug or alcohol addiction in the house. So, whole family support has got to focus on finding people where they are and making sure that the support is there. The thinking behind the promise is to keep families together as much as we possibly can do. All the data tells us that families are better if they are able to be kept together. Now, in some cases, it's not possible, it's not safe. There are exceptions, but generally, that is the prevailing culture. And it's important that services are aligned to make sure that support is offered where that family is. So, to answer your question, it's a long answer to your direct question, Linda. The drug and alcohol services that we make available have got to be part of this approach that we take to meet people where they are and help them to build their resilience and build their strength.
So a final question from me and from the audience. We've talked about the voluntary sector, community planning partnerships. We've all mentioned the NHS and local government. But local businesses have got a part to play in this as well, haven't they, First Minister? So tell me a little bit about your thoughts on that and anything you just want our colleagues to keep in mind when they're talking about cross-sector approaches for whole family support.
Well, I think obviously part of this journey is, when I talked in the early part of my contribution about the interrelationship of the 4 policy themes of the government. So one of them is about boosting the economy, and part of my cancellation of our visit was I was trying to boost the economy. That's my defence, Linda.
It's okay.
So employment, good, high-quality, sustainable employment is going to be a crucial component of how we support families to overcome poverty. Now, we have very low levels of unemployment in Scotland today, about 3.5%, but we've still got significant levels of economic inactivity. And at the same time, we've got shortages of people available for employment in a whole variety of sectors. So there will be people who are today economically inactive who need to be supported to enable them to become economically active. Some of that will come down to whole family support, because if a parent, for example, has an addiction, their ability to contribute constructively to the labour market is going to be quite constrained. So they have to be supported. If there are other issues in the family, they have to be supported to enable those individuals to be able to participate in sustained employment. If we can do that, then when I come back to those 4 themes, we've got multiple beneficial impacts as a consequence, and business has got a big role to play here. Now, there are, of course, a range of businesses who do some superb work and who are very engaged, and I'm very grateful to them for how they go about this in essentially recognising, again, meeting people where they are, that there were people who join the labour market who may well need a bit more support to enable them to be fully participating in the labour market. But one of the great privileges of my role as a minister over many years, particularly as First Minister, is I get to meet people whose lives have been transformed by good interventions. So somebody who's been economically inactive, somebody who may have been in prison, somebody who's had an addiction. And in my work, I encounter people who've got over all of that, who are participants, contributors to society, whose lives are better as a consequence. And that's the journey that we need to make more widespread for people. Because if we do that, then we will have lower levels of child poverty, we will have a stronger economy, we will have the resources to enable us to make the journey to net zero, and we'll have stronger public services, because actually some of those individuals I'm talking about will have less requirement on public services. They may in fact become public servants and deliver those public services. So it's about seeing all of that, how it connects together and how it can make a difference for people. And fundamentally, it's about the journey of transforming people's lives. And that's what we're all in the business of trying to do, transforming people's lives to ensure that they are able to fulfil their potential, and that starts with our children.
Well, thank you, First Minister, for sharing us your thoughts, your insights, and responding to some of those questions. I think that's given us a lot of food for thought. We're going to have one more session now, just before a short break, but please join me in thanking the First Minister. So really delighted for the next session, which is about hearing how system change is happening to improve whole family support through an example of what I regard and many others as really inspiring work. So we're going to hear from how East Lothian is progressing whole family support in action, what it takes to get there, and the impact it's had, and also just to inspire us all to act. So really delighted to introduce Gavin Russell from Scottish Government, who's joined by 3 colleagues from East Lothian Council. Thank you.
Thank you very much, everybody. I'm just going to put my notes here. As Linda says, my name is Gavin Russell and I work in SIPIC. We provide quality improvement support nationally and locally. And for the past 3 years, my focus of quality improvement support has been working with Caroline, Lauren and Ali, who are currently moving in onto the stage, as far as I can tell. And I just want to start the session. You'll hear more from Caroline, Ali and Lauren in a second, but start the session by saying that I'm delighted to have 30 minutes to spend some time with you today, because I believe together we have a really great story to tell you about how we have translated the policies, principles, theories and proposals for whole family support that we have at a national level into meaningful, impactful support that is taking place now as we speak across homes and families and communities in East Lothian. It's a story which starts almost 3 years ago to this very day, when myself and colleagues from SIPIC and Celsius travelled over what have become many, many meetings with a very skilled, energetic and, as I've learned, a very determined group of people to figure out what it's going to take to develop and deliver an improvement programme that would lead to whole family support being delivered in that impactful, meaningful way, to see that families getting the support that we are all aspiring to across the country when we talk about whole family support. And the story we want to tell you is, how have we made change happen in East Lothian? What are the methods? What are the tools? What are the decisions? What are the roles? What are the resources that have taken us to get us from where we were on that first day 3 years ago to where we are now, which, as I say, is as we speak, families in East Lothian are able to access that whole family support that we're all striving for. But for that to make sense, I first want to give you a sense of what change has happened, what has improved in East Lothian from that first meeting until right up to this day. To give you a sense of the context and what we're talking about and the scale of the change that we're talking about that East Lothian have managed to pull off. So the first part of the work identified very early on that there was a population or a group of families in East Lothian where their needs were a little bit more complex than universal services could respond to, but who didn't require intensive specialist support. And those families weren't quite getting those needs met. Those families needed whole family support. What they needed was services to wrap around them. What they needed were services who could be kind, who could be compassionate, who could be family-focused, strength-based and outcome-focused, and figure out what support the families really needed, not what we thought they needed, what they really needed from us. And in response to that, East Lothian have designed, developed, and now run a service called Families Together East Lothian. There are 12 family outreach workers now working in East Lothian, providing that direct one-to-one support with families, that early help support. And from my experience of seeing this support in action, I would absolutely say this is whole family support being put into practice directly with families. This is a service designed around the values of being kind and compassionate, listening to families, being kind and compassionate to them. So that's a significant shift from our first conversation 3 years ago to now, and a fantastic piece of work, and you'll hear more about that in a second. And it's not just that. The work together with East Lothian also identified that across communities in East Lothian, there are populations and groups and families whose needs weren't being met by traditional existing family support services. So in addition to that direct one-to-one early help support, East Lothian have also been able to set up and identify a whole range of community-based supports in that early help preventative space. And these supports range from informal drop-ins, where families can come into contact with services, find out what supports are available in a relaxed environment. They include bespoke parenting programs, providing parenting support based around what families say they need from parenting programs, not what existing parenting programs provide. Or they include groups like a peer support group for young mums who are isolated and need a space to connect in the community. And all of this has been developed, identified and developed and put into practice over the past 3 years. And I should say it's an absolute testament to the work of the people on stage and others that this is happening. And it's a story of some scale as well. If you think about the size of an area of East Lothian, it's not the biggest local authority, but between that first meeting 3 years ago to where we are today, over 740 families have been supported in total in that whole family support early help space. 419 of those families have been able to access that direct one-to-one outreach work in the community through the Families Together East Lothian service. An additional 326 families have been supported across the different community group and drop-in offers. And as an additional figure on this table as well, which I think is really important, there's over 20 partners have been involved in helping shape what Families Together East Lothian has become and helping deliver these community-based drop-in centres. This is a whole system approach. My colleagues here are from East Lothian Council, but this includes the Health and Social Care Partnership, it needs Children's Strategic Partnership partners, it needs the third sector, it needs the community. This is a significant shift away from where we were 3 years ago to somewhere their families can really access the support that they need. And it's an absolute testament to the work of my colleagues, who we hear about in just a second, that this has happened. This is what we've been able to achieve in 3 years. Whole family support in action. However, I don't do much of the family support work, so before I move on to tell you how we got to this, I'd like to show you a video from 2 of the family outreach workers who will describe and give you a sense of what that support feels and looks like. So if we can run that video, that would be fantastic.
We can have families that are maybe just not managing with their daily routine, or with certain behaviours at home or relationships. It could be that they have a health need unmet, or some house and financial support. It can be really varied.
Yeah,
or suspected
ND and help to get that process in place. Or sometimes it can just be a change in the family. If it's a separation, the parents have split up, or there's a death or something, you know, if their circumstances have changed, then they just need someone to help them regroup and make a plan ahead, a positive impact plan.
I think for us it's about building the parental confidence.
I think that's the biggest thing, isn't it?
And I think that when we've got a plan with a family, it's not doing, it's working alongside a family, because we want families to be able to sustain. So if they're coming up with ideas for the plan, it's more likely to work than us saying, I think we'll do A, B and C, because if they're saying, I've tried this before and it's worked, like, how do we keep that going? How do we work on that? So it's really strengths-based.
And it's about working on what's important for them. Not, we're not going in and saying, well, you need to do this or you need to do that. We're asking them, what do you want to work on? So it's they're choosing what they're working on.
What matters to them.
Yeah, what matters to them.
I think it's important that we're supporting families to engage in their community, to know what's available to them, that they're not isolated, that we are aware of what's going on in our community. And I think because we're seen about, I think it becomes more normal for families that